A bill now working its way through the South Carolina State House could change how doctors are able to move between jobs and where they're allowed to practice. Lawmakers are weighing a proposal that would ban non-compete clauses in physician contracts, a move supporters say protects patient choice, but opponents warn it could threaten access to care, especially in smaller rural communities. State House reporter Stephen Biddix has more.
Both sides agree that preserving patient access is what's most important. But while some believe these non-compete clauses do just that, others believe they do the opposite. Doctors do a lot for us, but Dr. Cleve Ham says non-compete clauses force doctors to uproot their lives or stop practicing locally altogether.
What has happened here is that if the physician leaves for any reason, the patient will not have the choice to follow that patient. They've lost their fundamental right to choose that physician.
This bill would ban those clauses, but employers could still recover costs like relocation fees or signing bonuses if a doctor breaks their contract early. Ham says some doctors take years off, just waiting for their non-compete to expire, just to stay near their families. That affects both patients and doctors.
You can see how disruptive this is to the patients, yes, to the physicians as well, no question. But this is not about something we're trying to do just for physicians. This is about the patients and the continuity of care, honestly.
Matthew Johnson, Chief Operating Officer at McLeod Health in Florence, says healthcare is a balancing act, and making it easier for doctors to leave could limit hospital services.
If you have patients that move somewhere else and follow a patient or follow a physician, or if that physician opens up shop right next door and takes those patients with them, that destabilization can erode the margin and make unsustainable some of the things that we do for our patients and the communities that we serve.
Dr. Heber Watson told lawmakers the bill would strain rural and small healthcare providers, and if a specialist walks away, the community could lose that service entirely.
When physicians leave and immediately begin practicing nearby, it destabilizes those systems, leading to reduced staffing, fewer services, and ultimately decreased access to care for patients.
The Senate could take up the bill for a full floor vote as soon as this week. Reporting at the State House, I'm Stephen Biddix.